Should I start? Good morning, Professor Ksharasutra and Professor Francis Chen. I'm Dr. Pravin Patil and I am from the proud land of India, from the land of Ksharsutra, who is considered to be a father of surgery. Today I am going to present the Ksharasutra treatment in complex fistula in ano. This is a study of 150 cases. All of you know, complex fistula in ano is a challenging condition to treat. For this study, we have defined the complex fistula in ano as the fistula which consumes more than 30% of external anal sphincter and all anterior fistulas in females. So, what is the Ksharasutra? Basically, Ksharasutra is a medicated thread, a chemical ceton, which is prepared by using plant-based ingredients. There are 3 ingredients. The active ingredients are coated repeatedly 21 times on barber linen number 20, so that a required amount of drug get adhered on the thread to achieve the therapeutic value. This is a kind of novel drug delivery system of ancient India. This is first of its kind, the time-release drug system. So, few drugs like turmeric, haldi, we say, that is useful when it is applied, that is useful for curating, for collapsing of the tract, for control the infection, for drainage of the tract, and ultimately the drugs which are coated like apamarga, they are useful for cutting of the tract. So when the thread is applied judicially, it helps in debridement, curating, draining, cutting, and healing of the tract. So how Ksharasutra works? Ksharasutra technique is a manual invasive procedure mentioned in ancient Indian Ayurvedic treatises for the treatment of complex fistula in ano. The Ksharasutra is placed in the fistulous tract with a special probe, and both of its ends are tied together. It is replaced at weekly intervals. We change the Ksharasutra in weekly intervals. We have to just make the knot with the previous Ksharasutra, and by railroad technique, we take out the previous Ksharasutra and we tie the another Ksharasutra there. Then it is replaced, the Ksharasutra remains in direct contact with the linings of the tract. Therefore, it physically and chemically curates out the tract and sloughs out its linings, and it facilitates the drainage and allows the cavities to collapse and heal. Once the cavities get collapsed and healed, we tie the Ksharasutra little tight so that it does the controlled cutting of the tract. Ideally, 1 centimeter tract should, there is a uniform cutting time. Ideally, we expect that 1 centimeter of this tract or 1 centimeter of the sphincter should have the cutting and healing simultaneously. So in this study, out of 150 cases, 33% were the males and 6.66% were the females, with the mean age of 40 years. There were 50% high transpintric fistulas in the study, 30% were the transpintric fistula with high interspintric cranial extensions, and 20% were have the transpintric fistulas with interspintric supralevator extensions. 10 among all 150 cases were the recurrent fistulas. 60% fistulas were having the internal opening at the posterior midline, and 40% were having the internal opening at anterior midline. So this is one of the case which we have treated, complex fistula case which we have treated with Ksharasutra treatment. So we can appreciate there is a external opening at the base of the tract travels posterior to the testicles near the deep muscles, and then it into anal canal at in between the superficial and deep external sphincter. So what we did here, we have made an incision in between the scrotum near the perineal body and anal canal, and we have intercepted the tract, and we have made the two different tracts. We have put one Ksharasutra in proximal tract and one Ksharsutra in the distal tract. We have changed the tract Ksharsutra for 2 times in the distal tract, and we have removed the tract, removed the Ksharasutra. And in the proximal tract, we keep changing for 12 weeks. That means 8 to 12 times we have changed the Ksharasutra, and we got the entire cutting of the sphincter complex and simultaneous healing of the sphincter complex as well as the tract. In this third picture, we can see how we change the tract, change the Ksharasutra, and in the fourth picture, we can see the healed tract or healed wound over there. We have the MRI pictures as well. In the first picture, we can appreciate the tract, the long tract from the base of the penis to the anal canal, or anal canal, anterior anal canal. Then this is the second MRI. We can see there is no evidence of any tract in the second MRI. In the third picture, we can see there is no external opening at the base of penis, and it was completely healed. So this is an example how we treat the complex fistula by using the Ksharasutra. And we don't need to dissect, because if we have done it by conventional method, then we have to dissect all these testicles and the important perineal structures, sphincter complex, and we can do it by very minimal invasive methods. So yes, 150, out of 150 cases, 140 male, 10 female, mean age was 40, and we achieved the successful healing in 94.66% cases. Mean duration of Ksharsutra application was 9.12 weeks, and few patients failed to heal, and they were 5.34%. Same successful healing in 94.66 cases. The overall mean duration of the Ksharsutra application was 9.12 weeks. The duration of therapy showed a statistically significant relationship with the presence of supralevator extension. Those fistulas having the supralevator extensions, high intersphincteric extension, they are little reluctant to get drained properly. After complete laying of the proximal tract by Ksharsutra application, the resulting wound healed completely within 8 to 10 weeks. We did the follow-up after 1 year. There was no recurrence of the disease in 142, that is 94.66% cases. There was, when we compare the study or the Ksharsutra treatment with conventional treatment modalities, which are associated with significant risk of reoccurrence, that is 0.7 to 26.5%, and there is a high risk of impaired continence, that is from 5 to 40%. In Ksharasutra treatment, we have 5.34% reoccurrence, and in 6% patient showed mild flatus incontinence. Post-operatively, we have done the anal tonometry. We have seen the anal pressure. Previously, it was in every patient it was near about say 40 to 100, and we have seen the same sphincter pressure after the studies. We have seen little flatus incontinence in 6% of our patient. They showed the mild flatus incontinence. So I conclude that Ksharasutra treats complex fistula and ano effectively and without any major incontinence. And I'm proud we have a legacy over 3,000 years. Thank you very much.
And happy to invite the next speaker, Kumar Dr. Krishna. The speaker here? Not? Okay. Okay.
Good morning.